So we talked about ulcers and tissues that can be affected by ulcers, but what happens when tissue repairs? Tissue repairs, it's a process of regeneration, and of course the only organ per se that is able to regenerate is liver. However, tissue repair constantly occurs and it's an ongoing process, and tissue repair can be considered a final phase in inflammatory process. After macrophages that invaded the tissues cleaned up the area and basically destroyed all invaders or any debris products, the growth factors will facilitate the repair process. So repair of the tissue will depend on regeneration of the cells and definitely the type of the cells that will regenerate, and again, like let's say liver regenerates readily and can basically recreate itself, while some other cells will not be doing as well. So hopefully it will lead to the normal tissue. However, if regeneration takes place as proliferation of normal cells, it's like in case of liver, will lead to normal function. But if there is a connective tissue starts appearing, then basically scar formation will not lead to regeneration or recreation of the normal function. Scar tissue can be produced anywhere in the body, so it's fibrous tissue, and fibrous tissue is a bridge, some kind of, between the normal tissue and the wound. But again, it will cover the wound, but definitely it will not be replacing it will not be functional. But eventually, through the process of remodeling and regeneration and formation of tissue, eventually we can see rather important and rather remarkable results, such as when we're looking at the burn, and when large amount of the tissue is missing, we still can produce good results by epithelial grafting, and which can cover massive burns and facilitate the tissue regeneration. So bones, on the other side, and bone cells, osteocytes, and blood-forming bone have also great ability to regenerate, and they can be even transplanted, like in bone marrow transplant, from one person to another. Let's talk about tissue healing briefly. Primary intention will be when we have surgical scar, surgical incision, or a stab wound. When we have a clean-cut incision, the line would fill with serum, the scab will form. In a couple of days, capillaries between the sides of the wound will bridge the gap, and in the next few days fibroblasts will grow across the wound layers and will start putting collagen fibers down, and which we also can call granulation tissue. And when collagen starts contracting, the wound edges will grow together and will form a scar. And primary union is usually first intention is very clear. healing of the scar. When we're talking about primary union, again, granulation tissue formation is rather minimal, and formation of the scar may be done minimally by the clean cut, clean incision, and eventually that scar may become even invisible. So secondary union, it's bigger, deeper wounds, again, decubitus ulcer, and they really don't have the ability to approximate edges of the wound because it's such a big space. Of course, if we have a bigger space, we need more blood supply, more capillaries, we need more fibroblasts, and we need more collagen to be deposited. By looking at this, we definitely can say, okay, then we need more nutritional support than what we're having tissue healing by primary intention. So in secondary intention, the healing process is much slower. Approximately 1 week, you will see the beefy red granulation tissue, and then scar tissue formation, and certainly the healing time will depend on the size of the wound. The bigger the wound, the longer it will take. Regeneration of epidermis is an important factor in this type of healing, and it may take really truly long time for epidermis to regenerate and epithelial tissue to grow. In some cases, the epithelial tissue may not grow in sufficient rate or in sufficient amount, so the wound will stay open. In these cases, maybe the grafting may be considered, but nowadays the wound healing became such an advanced science and technology. Of course, using wound vac technology can be definitely very beneficial for wound healing and prevent the use of grafts and more advanced surgical methods. Well, we can do this by non-invasive methods. Another important factor certainly is a good nutrition, which can contribute to healing of the tissue and the support of the nutritional team. So if wound healing is delayed, we need to combat the factors that may be delaying it. Of course, necrotic tissue has to be removed and debridement has to be performed, and there are many different ways to do this, but I'll talk about just two of them. One is the surgical way to do it, to debride surgically, and the other way is to use some type of pressurized wash or whirlpool. You may see this has been done in the extremity by using some type of whirlpool and immersion of the extremity, but the goal is the same, to take the necrotic tissue away. So if necrotic tissue is present, it will slow down the healing. So, and it will, of course, eliminate the source for bacterial invasion, not the source, but the medium for bacterial invasion. So what else can affect this? The tissue healing, of course, age is one of the main factors. The younger the person is, usually the easier they heal. Size, as I said, it was smaller wound would heal faster than larger one. Another set of factors that may affect this is location, nutrition, circulatory supply, vascular supply, and the virulence of your organism, or of bacterial organism. So if the virulence is high, so the wounds may tend to heal much slower. So steroids, corticosteroids may inhibit inflammatory response when patient is treated by them and have some kind of injury, and if inflammatory response is inhibited, actually this is not a good thing, because the bacterial invasion or viral even invasion can be facilitated, and the healing time will increase. So wound healing will be complicated by excessive scar formation, and keloid formation is one of the type of excessive scar formation. Usually it's noticed in African American populations. However, people of Caucasian origin also may have keloid formation. It's very difficult to treat this because removal of keloid may increase the chances of formation of new scar. Dehiscence is another problem, and dehiscence, when usually talking a surgical wound, and in case of dehiscence, the separation of tissue margins will occur. So keloids, as I said, it's raised scars and may create complication. The other main problem with wound healing is adhesions, and adhesions are nothing but fibrous bands of tissue that may attach to surfaces of the organs internally. So the problem with adhesions that they may present a significant source of pain, and they may also disrupt the functioning of the organs, such as adhesions in abdominal cavity may affect normal peristalsis and functions of the small and large intestines, as well as maybe again significant source of pain. And to deal with this, one of the interventions will be to proceed with removal of the adhesions, and usually adhesions are very difficult to spot on imaging studies, and one of the ways to finally diagnose this will be laparoscopic exploratory surgery.